So my name is Dr. Narwan, German board-certified plastic surgeon, and the topic today is to give you, I would say, an overview of everything what I'm doing in a holistic concept. What does holistic mean? Holistic means combining different treatments, different devices, different techniques to get the best possible solution for our patients. So I will tell you a few things that we can do for the face, but also for the body. So what kind of treatment options do we have for the face? Non-invasive treatments, skincare treatments, devices, lasers, we talked about it. We have more invasive or minimally invasive treatments, which are, for example, injections and threads, and the invasive treatments, the surgery. So I'm a big fan of combining different things because different structures, different targets, different goals need different treatments. But at the same time, I'm a strong believer that we cannot do everything by ourselves. So if you start to do everything by yourself, rhinoplasty, facelift, body surgeries, injections, etc., then you lose quality. But it's very important to work in a team like we do at Skin Experts, to be connected with experts and to know, okay, in case I have somebody who needs some of the treatments which I cannot offer, to send them to the expert. Because at the end, the combination of everything gives the nice results and, of course, the right solutions for our patients. The same thing when it comes to body contouring surgeries. There are a few things that we can solve with surgeries, but also there are many, many things that we cannot solve with surgeries. For example, if somebody is really overweight, we cannot solve the problem only with surgery, right? We have to work with dietitians. We can use devices. Some people maybe are not ready for surgeries because they do not want to go through a long downtime, etc. Then maybe we need devices like Cool Sculpting, M-Sculpt, etc. So, our patients, they come usually into our offices, they have a request, and they ask for something, and most of them nowadays, they know exactly what they want, right? One of the most requested areas is the so-called nasolabial fold. Doctor, please treat my nasolabial fold. Because they think if you treat the nasolabial fold, all the problems are solved. But it's not like that, right? That means we have to take time at the beginning, especially when we see somebody the first time, we have to understand our patients. And then it's our responsibility as a doctor to guide our patients. Nowadays, unfortunately, also guided through social media, that patients come to us, they know exactly what they have, they tell us what they want. Doctor, please inject this product in this amount in this line. But we are the experts. We have to take care of them. Of course, we have to understand them first, and then we have to tell them what they really need, and then we have to come to a conclusion together and then give the right treatment for our patients. Before doing a treatment, now I will tell you something about face treatments. So I'm specialized in minimally invasive treatments of the face. When it comes to face treatments, that means with combining different injectables. Before we can do the treatment, the assessment, from my point of view, is the most challenging part. The technical part on how to do an injection is something that you can learn. The more often you do it, the better you get. But the assessment, to understand the face, to do an analysis, this is the most challenging part, and this is also something that you can train. That means you have to train your eyes. For example, if we look at this face, we have to ask ourselves so many questions, right? Which is her best side? Does she look more tired, sad, angry? Which area should be treated first, etc., etc. It's not about treating single areas if you want a nice holistic approach. So very challenging. Let's do that together. When we look, for example, at her face, and we split her face, the left side and the right side. Please raise your hand. Who would say her right side is more beautiful and who would say her left side is more beautiful? Who's for left? Left, okay. Who's for right? I mean, both sides are not optimal. It's 50-50, okay? Let's do that. Now, the split face. The two left sides and the two right sides. What would you say? Which side looks better? Are you still for right? The right people who said right? Left? You stay for left? I personally am for the right side. But, I mean, it's difficult to say. You see, we are all experts, right? But if you ask experts, everybody has a different point of view. So it's important to analyze faces and also to ask our patients, what do they really want? For example, volumizing, when you look to this side, although we are volumizing her face, it's not getting worse. So analyzing first before it comes to the treatment, that means faces are like books, and books are written in chapters, in paragraphs, and in sentences. And as Dr. Danny already said, do not focus on one single area. For example, if young patients come to us and ask for lip treatment, if they have other issues, we have to tell them that, because we want to keep everything in balance. Imagine, for example, Angelina Jolie, right? Everybody is talking about her lips. Her lips are beautiful. But imagine Angelina Jolie with a short chin. She would not look nice anymore. Right? She would not look nice anymore. It's the same lip, but she loses balance. So therefore, also address other areas, because we do not want to over-treat single areas. So what are the three pillars of injectables that we have today? We have the neuromodulators, which is mainly Botox. We have filler products, which are mainly hyaluronic acid. And we have the so-called biostimulators. And now, how can we combine all those things to get nice, harmonious results? This is one of my patients. I treated her at a congress. It was in Switzerland. And one more important thing, when we take photos, we have to make sure that we take our photos always standardized, before and after. Otherwise, we cannot compare them. A very famous friend of mine, a colleague, plastic surgeon at a big congress, he gave a presentation, 20 minutes. He presented the case, the before and after, and then he said what he did, peelings, injections, and everything. And at the end, he said, guys, I have to tell you something. I did nothing. I just took the photos in a different way, right? So if we want to really to analyze photos, we have to do it in a standardized way. So this lady, she complained about nasolabial fold, about the marionette lines, about the jowling. You see she has some sagginess in the double chin. So I treated many parts of her face. Also her temples, you see some hollowness in the temples. I always start first, because this is the cause of the problem, as also my other colleagues said, right? This is the cause of the problems. This is the signs that patients see. But try to fix the cause of the problem, because we don't want to overfill single areas. Also in contraction, in motion, you see she has also the indication of Botox treatment. And this is her immediately after. So I combined many different things, HA fillers and also biostimulators. Of course, the effect of a biostimulator is not immediately visible. That needs time. But this is her result before and after. Also, when you look at the side view, chin treatment, you see also nice improvement of the double chin, the lateral midface, the temples. All those areas were treated immediately after the treatment. So, biostimulators. It is very difficult to capture the effect of biostimulators, because they cause collagen stimulation, and how can we see that? And as a plastic surgeon, we look different at photos compared to dermatologists, for example. By the way, is there any plastic surgeon here? Only dermatologist. Well, I know. I know, of course. So as a plastic surgeon, we also are used to see more dramatic or drastic changes, right? Saggy face, facelift, everything is lifted. But here we have to take more care on the details. So I treated this lady. It was for a clinical trial. By the way, it was a PLLA, mainly in the lateral part of the mid-face. And this is her result 8 weeks after the treatment. And my target was especially this area, the accordion lines. And you see already after 8 weeks, a nice improvement. And I did not mix it with any other products, because I really wanted to know what can I achieve only with these products. Of course, we can combine it also with HA fillers, with lasers, with peelings. But if you want to see the effect of one product, then we should not mix it, especially when it comes to clinical trials. And this is her oblique view after 8 weeks. And you see the same lady after 5 months. It has become better. So we have to tell our patients, especially when we use biostimulators, you will not see the result immediately. It needs time, 2 to 3 months, maybe sometimes longer. But I always recommend when patients come to us, when they do treatments, especially when they come the first time to you, always do something that is also visible for them. Otherwise, they will not trust you. They will not come back. That means you always have to do something that is visible for them, and you have to tell them and to guide them that this kind of effect, especially when you look here at her marionette or jowling area, the accordion lines, a nice improvement. And with these treatments, we do not just change the situation, we are also prophylactic, right? Because we also want nice, long-lasting results with the collagen stimulation that you're getting. Also some closer. This is, by the way, this is our esthetician in our clinic. I did an upper eyelid surgery for her, also full face treatment with injectables. Also here, you see with fillers, we literally also can, when we place it in the correct layers, also lift. For example, if you see her double chin, a very nice improvement only with injectables, without surgery. So now coming to the body. This is my surgical focus. What I'm doing is body contouring surgeries. So when we look at the perception of beauty for females and males, we see that the perception of beauty about the last decades or centuries for females has changed. We had the skinny types, the curvy types, but when you look at male bodies, you see that the perception of beauty was more or less similar, right? Always strong and sculpted. This is what people want. So the desires of patients have changed, our knowledge has changed, our skills, surgical skills has changed, and also the devices that we have nowadays has improved a lot compared to the past, so we can get very, very nice results in terms of contouring the body. And these are the trends nowadays, and these are the trendsetters. Also, for example, Kim Kardashian, she was very, very curvy, nice going and shifting more into the toned and sculpted shapes. So the trends are clear. People want to look fit, they want to be strong, but at the same time, and these data are from Germany, we have a lot of obesity. Okay, and not everything can be treated with only surgeries. That means if somebody's really obese, we have to do other things maybe before doing the surgery. This is something we don't want to create. This is funny, right? The other one was okay, but this one is very challenging to handle now. He's from UK, I think. So what is the problem? Why his six-packs look so fake? Because his main problem was not solved. And his main problem is visceral fat, right? Now he has a so-called turtle. We call it turtle pack, right? So the doctor just made some squares on the tummy, and it's not fitting to the total body shape, and also not to his main issue was not addressed, which is a visceral fat, which you can only target with special diet, sports, etc. That means lifestyle optimization. Why do we get that? I, as a plastic surgeon, can say that. Because we plastic surgeons, we think that we can solve everything with our own hand. But this is not true. We cannot solve everything with our own hand. So not everybody is ready for surgery, and not every patient can be treated with a surgery. So, as I said at the beginning, the right communications with our patients is very important. Usually when I start with my communications or my first consultation with my patients, I speak really a long, long time. Of course, for surgeries it's necessary, but also for minimally invasive treatments, when I see them the first time, I really speak for a long time because I want to understand them and I want to guide them. And we cannot do that in 5 minutes. You need really time. During that, we have to set the right expectation. We have to select the patients for the right treatments. We have to educate our patients, and we have to support our patients. And when do we start with our communications with our patients nowadays? Before they enter our offices, through our social media channels, right? So this is the way that most of us use nowadays to communicate with our patients. And this is something that all of us should do. We are professions, and we are doing this kind of treatments, and it's important to communicate it and really to guide our patients. I try to tell them, give them information about the devices, setting realistic expectation. I talk about healthy lifestyles, and I try to lead by example. Also, long-term videos where I talk about the different devices. This is a video. Can you play it? No, it's gone. Anyway, it was a video about where I showed the different devices. So also when it comes to surgery, I combine different devices to gently remove the fat. I use the VASA, it's an ultrasound-based device the Renuvion for soft tissue tightening, skin tightening, power assistant device to remove the fat, and also maybe to re-inject the fat. And of course, we have to educate ourselves, like we do here, right? And Albert Einstein once said, once you stop learning, you start dying. And this is true. You always try to improve, go to conferences like this to improve your skills. So, and when you see how people are doing it here you see, for example, a car is driving in, it takes them just 3 seconds to do the perfect job. So it's always a teamwork. So before surgery, we start with specific diet and workout programs in cases we do not have the right patient for the surgery. Sometimes we start with non-surgical procedures, and also we prepare our patients for the post-operative treatment when it comes to body contouring surgeries, because it's not just the surgery, also the aftercare with compression garment, massage, etc. It's very important things that patients has to follow to get a nice result at the end, because you can do a perfect job in the OR. If they do not follow and your instructions, they can really destroy the result. And after the surgery, the total shape is very important, and not to overproject also here, to keep it as natural as possible, because trends come and go, but the natural result will stay forever. So also here, of course, breast surgeries, augmentations which can be done with implants, with fat, also in combination, the so-called hybrid breast augmentation, or lifting surgeries, for example, when they have big breasts or after breastfeeding. And this is a so-called auto-augmentation. That means replacing the gland without using a foreign body like an implant. Also combination surgeries, I try to avoid them, because the more you combine, the riskier surgery you can get. But in her case, it was not possible to do it in another way. It was a tummy tuck and a breast reduction with breast lift. Although the result is very, just a few weeks after the surgery, you see redness on the scar, etc. And these things, for example, afterwards can also be treated very, very nicely when we have experts in scar treatment with lasers and with other treatments. So you have to combine many different things to get nice results at the end of the day. What else do I do nowadays? Fat transfer to the butt, as I told you. In the butt, it's very important when we do the fat transfer to be superficial, not to go too deep. It's a danger zone. Maybe you've heard about the dangers. So you should avoid to hit the muscle. You have to be superficial. You must know exactly where you do your injections. There are some safety guidelines, international safety guidelines, where it's recommended in some countries, it's mandatory to do it with ultrasound. And for high-def body contouring, there's also another video, but we cannot see it. It's a video where I present how I inject the fat into the muscles to really gain muscle volume. Initially, as we started with high-def body contouring, we just removed fat from in between of the muscle. It looked really a little bit fake. But nowadays, I try really to remove as much as possible. And if I want more muscle volume, then ultrasound-guided fat transfer. Also here, another fat transfer case to get a nice silhouette, and do not focus only on one part of the body. These are one of my recent male cases where I did, for example, the fat transfer into the muscle to make it as natural as possible. The aim should be, if this gentleman is with his underwear on the beach or on the pool, nobody should look at his tummy and say, six-pack, but it looks somehow fake, right? It should look as natural as possible. And also, this is also another video, but we cannot display it. It's important to see it also on videos, on motion, when they breathe in, when they breathe out. On photos, sometimes it look very nice, but when they move, then it can sometimes look very weird. So it's important to judge also while you... This is also another video, but it's not playing. Sorry, another video, it's not playing. Unfortunately, because I want to show you also how nice soft tissue can retract when you use the right devices. This gentleman, I did a combination of liposuction of the neck and a chin and jawline treatment with fillers. He is very sporty, by the way, but having a double chin gives you the impression, okay, he could be a little bit overweight. And afterwards, that was the combination of removing the fat and contouring the face with a J filler to giving more sharpness. Now the face matches to the body. A lot of my patients who share also their images afterwards on social media. So what this images shows is that they really feel well in their appearance, right? So they feel well. It's an improvement of lifestyle for these kind of patients. This lady, for example, she has after pregnancies, rectosteostasis, as Dr. Dora said, she's doing sports on a very regular basis, but this is something you have to do the surgery, right? There is no other options. You cannot treat it with any device or anything. So I did a so-called lipoabdominoplasty, tummy tuck with liposuction 360. That was a surgery. After a few weeks, we did some laser treatments of the belly button. She's coming also from Switzerland, and these photos were on her social media. So she's presenting her case because she has a very healthy lifestyle. You see how nice when you combine healthy lifestyle, sports, and the surgery, what kind of results you can achieve. So the key messages, it's important that we communicate in the right way with our patients right from the beginning. We have to educate our patients like we educate ourselves. We have to support our patients, combine different approaches and different devices, and it's very important that you have an experienced and skilled team because you cannot do everything by your own. And by doing that, we do not just get people who have a better appearance, we also help patients to put their lifestyle, their well-being, and their health to a better and higher level. We would get nice, long-lasting results, and then we would have patients who does not look just better, but also feel better. Thank you very much. And sorry for the technical problems. Okay.
It was a great talk, Dr. Narwan. We're running a bit late, so do we have any questions? We can take 2 questions. Yes. There is no other workshop after this, so we can take our time a bit, but we don't want to. The first question is there, yes.
Thank you, Doctor. I just want to ask one question that I want to know the 2 ideas of the dermatologist and the plastic surgeon about that, the HIFO. Many doctors, they don't like HIFO, they don't believe that somehow, but I saw that you are a fan of the hypotropy and you are doing regularly. So I want to know that why some doctors, they are not believe on the HIFO. And as a surgeon, I heard that after a while, whenever we are doing multiple time of the HIFO, it will affect the isthmus layer. So in future, when they want to do the facial surgery, it will be a big problem, right? So I want to know these 2, please.
Look, every tool has to be used properly in a customized way and with preparation for whatever treatment you want to do. As I mentioned, when I do HIFU alone, and HIFU varies, there are some devices that have more power than others, but every device, it's the operator that's much more important than the device itself. And it is also the candidate that you're using it on. If someone has, needs something else, you do 10 sessions of HIFU, they're not gonna get better. In my practice, I always do the proper volume restoration. I do the muscle denervation face and neck. Most of the time I do the neck unless they really don't have any platysma, movement, and that already helps. And I do the HIFU on top of that. In my hands, I've been very fortunate with good results with this approach. I had started with Thermage way before, and when I learned that from the Thermage days, because when Thermage days, we didn't do much filler, we didn't do much Botox, and the results were very, even though it's a good device. But as we do it with a proper approach, I think the results are much better. Also, talking about expectations to your patients is very important. So I don't think it's about believing or not believing. You usually pick the devices that you want to use, you try them, you look at the literature, you see what's reported, and then you do them properly, you train properly, and then you apply them intelligently. And this is the recipe for a good result. In my practice, 9 out of 10 people love the HIFU, and they refer others, and people vote with their feet. They come back and they do it and they refer friends. Does it affect the SMAS in a way that it will make it hard for the plastic surgeons to dissect? I really don't think so. The thermal damage, it's pinpoint, it's 1 millimeter. It's not like injecting PLLA or hydroxyapatite.
Yeah, that's why I want to know that how long, if once per year. if it is 2 times per year. I want to know that how we can keep it.
Look, I usually tell patients the ideal
intact.
interval is twice a year. That would be the ideal. I have people who do it more often. Most people do it less often. It's expensive also. You know, we do it as physicians. We don't delegate it to nurses or assistants. So it's the dynamic of your practice. Dr. Narwan or Dr. Rami, you want to add something about
Exactly.
HIFU?
So I'm not doing facelift, so I would address this question to Dr. Rami. But I haven't seen any or heard from other colleagues any that it's challenging for them to do a facelift after HIFU. But I've heard from other plastic surgeon colleagues who have problems, especially when you use, for example, biostimulators like Sculptra. When they say when they cut, when they open, they see a lot of scar tissue, and then it's very challenging for them to do the treatments. I've heard about that, but I have not personal experience. So whatever we do treatments, we have to make sure that the products that we're using, that they are, of course, also safe, right? That they are scientifically proven in terms of quality, risks, etc. Sometimes you don't know, right? And when you go to the big conferences, you see how many products enter the market each year, right? Sometimes you know it after 5 to 10 years. Okay, we did that, it was nice, but afterwards we created some problems. So whatever we do, we always should try to aim, and this is our responsibility as doctors, not to harm. Of course, we want to optimize, but we should not harm. One other thing, why you can harm when you do, for example, multiple injections and treatments, doesn't matter what kind of product you do, you traumatize every time, right? You go with your cannula, you traumatize, you create an inflammation. So be also very gentle in the way that you do your treatments. So gentle and, of course, not too much.
Thank you. Yes, the question is about Kenalog in the nose to thin out bulbous nose. First, you want to select the patients right. So it has to be those patients who have like a squarish, round nose where the skin is thick, not and it's not, the problem is not cartilaginous overgrowth, because in that case you risk thinning the skin, even though maybe you delay the cartilage growth, but I don't think that's an indication at all. So the proper selection. The concentration of the cortisone, we use Kenalog, and we use it between 10 and 15 milligram per ml. We inject, about 0.02 per thread, and it's usually like 3 threads here and 1 thread here and 1 thread there. At this concentration, thank God, I've never had a problem in terms of atrophy or infection, which is another thing that happens with steroids. I attended a conference in another country where the doctor was using higher concentrations, 20, 25 milligram per ml, and half his pictures had indentations. So select a very, that level of concentration, 10 to 15 milligram per ml, use small amounts, in like precisely intradermally, without blanching, because if you're blanching, you might be too superficial. Then, and that's safe. I've been doing that 7 or 8 years. I've done, I can say probably hundreds of cases. We haven't been counting them, without any significant issue. Okay, last question. If you don't mind, if we're running late, we're here. Nobody's after us.
So first, for Dr. Touma, I would like to ask, you said that you inject the temple gunshot with 30 gauge needle, right? And then I wanted to know what product do you use for that? Because normally in the bone you use a high G prime.
First, personally, I don't like that gunshot word because it sounds aggressive. It sounds as if you're doing it just in one area, because that's how it was described initially. You go here in the center, you inject, they called it gunshot, and then you massage. I inject in different points, and visually I'm making sure that this, hollow is getting elevated. Okay. So I'd like to, although I use sometimes products that are a bit thicker, like the Juvederm 4 or Voluma, I prefer to use a 30 gauge needle because I feel it's less trauma to the area, less risk of intravascular injection. And typically it would be like the Juvederm 3 or RHA 3 or 4 or some of these products. Occasionally I would use something even lighter, but my go-to is the products that I mentioned.
Okay, and then a lot of anatomists, well, two of them that I've heard before, mentioned that with this technique, there is the risk of stroke due to, like, they're in the, the skull, so there's the bone, so there's some perforating veins and arteries that cross across the bone and inside the bone. Should we, have you heard, like, or what do you think about that?
This is mentioned, Dr. Rami, the doctor is saying there are perforators to the skull.
Yeah, temple.
There has been research about it, and they have been tried to do that. It will take an 18-gauge needle to do that, and it will require a lot of force. And if that does happen, then probably you should not be doing this.
No, because sometimes what happens is that they're not inside the bone; they come outside of the bone. That's what they described, and it was in one of the.
Oh, so not the needle, but the material itself perforating through the bone.
Yeah, exactly. It's like this arteries or vein, they just cross across the skull, right? I forgot the exact name of these veins and arteries. They have a funny name. And then sometimes there have been cases of stroke from filler because once you put the needle, even though you touch the bone, you are not inside the bone, you're on the periosteum, and then you inject the bolus or the material inside that vein or artery.
It can happen.
Yeah.
That's where,
Aspiration.
pulling, yes, aspirating for like 3 seconds to make sure you don't have a backflow because sometimes it's slow. Look, any injection carries the risk. If you want to have zero risk, don't do injections.
Exactly.
You minimize the risk, you take your time, you pay attention, and
Yeah.
That would be an exceptionally unlikely event.
Exactly.
Just to give you perspective, I've been doing temples and that technique for probably 10 years. Alhamdulillah, till now, I've never had a vascular event. It's probably going to happen the next time, maybe, statistically. Inshallah, la.
Inshallah.
Yeah. Okay, we have to proceed.